Hi, this is Dr. Pham with the Reach Center, and today we're going to be talking about early detection of CP. So I wanted to talk a little bit about early detection today. When I say early detection, I'm talking about early detection of cerebral palsy. And there is a big push in the CP community for early diagnosis, early detection, which means diagnosing before the age of 1 or 2, which historically was when we were diagnosing CP. So we can, with the tools that we have now, diagnose CP sometimes as early as 3 months corrected age. So that means if a baby has a history of prematurity, that is corrected for their prematurity. When we think about how we do early diagnosis or early detection, there are a number of tests that we use. I would say the most common ones are the general movements assessment and the otherwise known as the GMA, and the Hammersmith Infant Neurological Examination, or the HINE. We use these along with imaging, with clinical history and clinical evaluation to follow an infant, follow a baby through that period of early development to see if they may have cerebral palsy. Now, the big question is why? Why would you do this? Why does anybody care about diagnosing at 3 months versus 12 months? What is the difference? They're getting early intervention. Why would you need to worry parents about, a potential diagnosis? And the reason is because of neuroplasticity, number one. So neuroplasticity is the brain's ability to sort of build new pathways in the setting of an injury. So when you've injured a brain, the maximum recovery from that injury, the maximum neuroplasticity happens within the first 6 to 12 months. So that is a really critical period of time when we should not be just doing early intervention, but really intensively intervening to maybe even change a child's functional outcome, which we've never really thought we would be able to do with any sort of intervention. CP is thought to be and is a static injury to a developing brain that results in motor dysfunction. Being that it's static, we've thought that we're not necessarily able to change a child's functional outcome. Now we might be able to. The other two things that it allows us to do is to provide education and guidance to families. Families are often very appreciative for having an early diagnosis so that they can educate themselves, so that they can look at resources, so they can advocate for their child to have the best possible outcome. If they don't know about it, then they can't advocate for their child. The other that we talked about was, in addition to early intervention, early screening. So for things like hip subluxation. So children who have cerebral palsy are at risk for the hips subluxing or moving out of the sockets. That's something that we can detect early. If we don't have a diagnosis, we're not necessarily looking, and so we're not able to detect it early in some instances. So it allows us to do other sorts of surveillance that may be important. So early detection, there's a lot more research on it these days, and a huge push in the CP community for it. Thank you so much for watching us today. We hope you were able to learn something. Please check out the rest of our YouTube channel and also check out our website for more information, reachpedsrehab.com. Thank you so much.